My name is Sheena Liu. I'm the founder and CEO of Medebound Health, which is a global cross-border telemedicine platform and the digital pharmacy distribution system that connect patients with critical disease such as cancers outside US with doctors in the US. The game here is that patients outside US, they have limited access to the US top medical resources, and it becomes very devastated to them. Traditionally have to travel thousands of miles to the US for treatment, but that's very costly and very time consuming, and now COVID prohibited from traveling, right? We are trying to disrupt the medical tourism space by having patients to be treated locally in the comfort of their own home without the hassle of travel. But having the medical expertise from the US top specialists providing that level of guidance and comfort while they are treated at their home country. I was a physician by training in China, and while I was as an intern physician rotating around pediatric oncology department in China, I have personally witnessed numerous deaths that has been caused by pediatric disease such as leukemia. And my heart would sink by knowing that those patients are not possibly salvageable and their parents are very devastated. And in that condition, later I know that actually those patients can be saved. At that time, the leukemia cancer 5-year survival in China is only like half of that in the US. In US, it's a highly curable disease with 90% 5-year survival. So I feel that the patient that could have been saved can be possibly saved through telemedicine. Now telemedicine becomes the mainstream, but mostly domestically. It's a very widespread platform and modality. However, cross-country telemedicine remains a large, underexploited market. I believe things need to be done in this space to help bring hope and possibly save lives through telemedicine, bring the latest and greatest treatment strategy, expert opinions to patients that far away from the medical excellence we're in the United States. Needless to say, when patients are outside US, they want to see the top specialists from the top university hospitals. Those are the elite research hospitals doing, having a lot of specialists in every disciplines. And we started in like 5-6 years ago, starting from a very select cohort of physicians. They are affiliated with New York Presbyterian, NYU, Mount Sinai, Mass General, those physicians. And they help make an intro for further physicians to participate. Once you have established a small cohort to start with, later, and they can make an introduction and recommendation for their other physician friends who can further participate. And of course, through the collaboration with Mr. Castle and Dr. Connolly, who is also in our board of directors, they are very substantially helpful to establish that network of physicians. So now we have signed up more than 1,000 specialists in the United States, mostly from the top 20 university hospitals. For the physician's perspective, helping patients outside their hospital itself, they find it interesting, they find it also rewarding. For example, a doctor at Sloan Kettering, they can help patients like in another part of the hemisphere and to save their life, provide opinions. Itself, it serves also a humanitarian cause, right? But also, they use their leisure time, maybe after work, and do a few consulting here and there. It does not consume their day-to-day jobs energy, but also they can have financial compensation, which is considerable as compared to when they see the day-to-day patients. I think this is, I would say, universal global problem. Currently, we are focusing on the Asian market with China to be specific, because there are, so many billion people. But we do see that this kind of services can easily extend it to South Asia, to Middle East, to Latin America, to Africa. And in all those regions, there are patients similarly diagnosed of cancer, or they have a kid diagnosed of rare disease that otherwise may not be saved. They can seek help from us. Traditionally, we do contract with insurance companies where we provide the services which is reimbursable from the insurance carrier to their members. We also marketing through the KOL physicians in local countries where they make a referral when their patient, oftentimes request, how can you save my kid's life? Is there anything we can do better? Can you help us connect to better physicians? So that's our traditional of our marketing force and sales force. But also lately we start to have more and more inbound the patients coming from the search engine optimization. They find out from Google, or they and then once they use certain keyword, find us and get onto our landing page, and they establish trust by reading about who we are and all the prior cases we have successfully helped the patients, and then they would actually initiate a call with us, and they become our paying customers and they convert. So we see that this type of inbound marketing strategy by bring social media, search engine optimization could possibly expand our existing sales force in one country to many other people, because everybody using Google to search as a first gateway to find the use for medical information. We have been, in the first couple of years, it's been bumpy road. I travel constantly, but the last 3 years we have seen exponential growth, which we are very excited about. Starting from 2018-19, we are having like 15x growth. Up to last year, we are having 10 million recurring revenue in 2020, and this year we're on track to have an additional 30% growth based upon what we have built last year. So we see this is a proof of concept. We see that we have validated the market that a patient actually do have the need for the medical expertise here, including the pharmaceutical products. So we wanna continue grow, and we also are looking to seeking investment to facilitate that growth. I mentioned about this 2C strategy. I think if we are able to use the modern 2C marketing strategy through social media, search engine, get our landing page out there, and then get exposure to more and more people outside US, and I think then we can attract patients all around the globe to take advantage of our services. So I think one portion of our investment money would go into to fund that 2C strategy, because we believe we're a global cross-border telehealth company. Other aspect would be enhance our existing technology platform. We have a telehealth platform, and enhance our direct relationship with pharmaceutical companies to establish sourcing channel for the access. I'm excited about many things. I think a pandemic has sort of, in a way, opened the door for people's acceptance of telemedicine. People already sort of get acquainted to this kind of modality to conveniently seek care. Likewise, in the global telehealth space, it's largely underexploited. I think we are embracing this era of new time of of global telemedicine, and we hope to help more people with the need to seek advanced care, quality care in the United States. So unlimited possibilities, and I'm excited about many things. So first of all, I must say that I'm very lucky to be part of the StartUpHealth community, that knowing that this community has 20 plus countries, portfolio companies, right, the health transformers. I think I want to welcome the opportunity to collaborate with companies from other countries, that if they see potential synergy and the connectivity of their patients that had that interest to access US top specialists from the best hospitals, I like to reach the art to say that I welcome all type of collaborative discussions. I like to explore. So at this moment, I think any country that speak English and or sort of have certain level of English, not maybe official, but people, they actually understand English, that would be the, I would say, preferable starting point to connect. And because we can easily facilitate the access. But moving beyond the English-speaking part, we want to expand to other countries as well. And I think the idea is that we need to have a local team speaking the local language to facilitate customer services, so that they will have the best customer experience using this type of duolingual tele-platform.
Perfect. Nice.
Thanks.
Start there.
Okay. You asked all the great questions.
Wonderful.
Oh, thank you.
Anything perfect. Nice.